Okay, recording. My name is Bobby Vaught. Here's an easy prediction to make. This is August 1st, 2024. What you're going to see over the next several weeks between now and November 5th, 2024, Election Day, is a lot of flowers when it comes to Kamala Harris. You're going to see a lot of hotties for Harris galore. She's going to avoid the tough question interviews like the plague. It's not going to happen. She's going to be very protected. Okay? Let's go back and look at issues, shall we? Let's just pick one thing here. Healthcare. There's a big issue that people like to talk about once in a while. Here's doing a search here. Here's one from the Washington Examiner about banning fracking. Well, we're focused on healthcare. Okay, so here it is. I'm just going to read this. All right. Harris has overtly supported, this is from 2019, Harris has overtly supported eliminating the private health insurance currently used by 226 million people in the United States. So much for Obama's promise of, if you like your health care, keep it. I guess that's, I don't know how Harris is going to stick to that promise. Harris has overtly supported eliminating the private health insurance currently used by 226 million people in the United States, or more than two-thirds of the population, telling a CNN town hall in 2019, let's eliminate all that. She's on record numerous times as saying she's in favor of, a more single-payer health care plan. Telling a CNN town hall in 2019, let's eliminate all that, when asked point blank if she would ban private health coverage as president. So basically she wants to, a Canadian style single payer plan. The definition of socialism. We don't like those evil corporations, so let's turn over all means of production to the state, thereby making government the world's largest corporation with no competition and no higher earthly entity to check it. All right, so doing a search here, my search was, why is Canada's healthcare system failing? That was my search right there. Page after page after page of this stuff. I mean, it just goes on and on. From the Guardian, Canada's have and have not health system lags behind. From Fraser Institute, from Reuters, what ails Canada's healthcare system? The National Institute of Health, Canada's primary care crisis. This is like page after page after this stuff. Canada's healthcare system in the toilet. CBC, I think that's Canadian Broadcasting Company, I'm not sure. From CBC, healthcare is showing the cracks it's had for decades. College of Family Physicians of Canada. Canada's healthcare system on the verge of collapse. Canada's National Observer, our healthcare system is crashing. Another one from the Fraser Institute, another one from CBC. This goes on and on and on. Let's just pick one of these articles and see what it says, okay? I don't know. Kind of pick one at random here. How about Canada's healthcare system on the verge of collapse? Let's see what it says here. From the College of Family Physicians of Canada. It's not just one article. It's like page after page after page when you do a search like that, demonstrating that Canada's healthcare system is on the verge of is collapsing. College of Family Physicians of Canada is sounding the alarm of a healthcare system on the verge of collapse. Family medicine is the backbone of the Canadian healthcare system, etc. Canada's National Observer, our healthcare system is crashing. See what this one says. In Alberta, where the UCP has made a point of undermining the morale of doctors and healthcare workers with direct funding cuts and refusal to take COVID-19, this one's a little bit old, and other respiratory viruses seriously, the issue is particularly acute. Our entire healthcare system is at stake. Basically, they're saying that Canada's healthcare system couldn't handle COVID. It just wasn't equipped for that. Edmonton's pediatric hospital was so short-staffed last month and so overwhelmed with patients that it canceled and delayed surgeries for sick and injured kids. Canceled and delayed surgeries for sick and injured kids. As a pair of doctors noted in a December 25th letter to the provincial government, several children each week are having their treatment or surgery canceled. Several children each week are having their treatment or surgery canceled with no guarantee of urgent rescheduling. Things aren't much better in other provinces, which all face the same dangerous combination of a depleted workforce, debt-focused governments, and ever-expanding demand from an aging population, etc., etc. Let's try another article here. How about this one? CBC, I think that's Canadian Broadcasting Corporation. Massive new survey finds widespread frustration with, and the title is, with access to primary health care in Canada. This is what the left has been so fond of promoting for decades. Oh, we just need a healthcare system like they have in Canada. Let's see what this one says. Toronto-based research team met with and surveyed some 10,000 Canadians about the state of the healthcare system, and what they found is deep dissatisfaction and frustration with primary care as the country grapples with a severe shortage of family doctors. Despite the diversity of the voices that we heard from, it was clear there was so much people this isn't worded very well. It was clear there was so much people in Canada agreed on, blah, blah, blah. Primary care is falling short. Far too many people don't have access to what is the front door to the healthcare system. We're a country of haves and have-nots. So many people have absolutely nothing, no access, and I think it's shameful, actually. The report found evidence of what it calls an attachment crisis. An estimated 22% of Canadian adults, about 6.5 million people, do not have a family doctor or nurse practitioner they see regularly, etc., etc., etc. This is like, I mean, you could literally find, I don't know how many dozens of articles easily about Canada's healthcare system in the toilet. You know what the left never bothers to explain when they talk about the transition to a single payer plan? What they never bother with is how do you make that transition? And here's what I'm getting at. You have just one company, United Health Corporation. It's one of the largest insurers. Of that one company, I'm looking at on the financial page here, the screen for United Health, market capitalization of $524 billion. That's just one company. It's one of the largest ones, not to mention Humana, all of the other insurers, the hospitals, stock in HCA. That's ticker symbol HCA. It's they run hospitals, all the doctor. How do you transition that? What are you going to tell shareholders? They won't find enough money anywhere to be able to compensate people for the loss of their shares. What are we supposed to do? And by the way, if you don't own shares in one of those companies directly, You very likely do if you have an ETF, various dividend-growing ETFs, United Healthcare, United Health Corporation, an insurer. If you have an index fund, you almost certainly own shares indirectly of United Health and others. So how are you going to transition that? Are we just supposed to play hot potato with our shares? One person sells it, and the next person tries to dump it on somebody else, and the next person dumps it on somebody else. Whoever happens to own it last, when they make that transition to a single-payer plan, gets stuck. Complete loss of capital. Used to talk about, you remember, those of you who remember, a younger crowd may not remember this, but roughly about, it's about 20 to 25 years ago, the big thing about Enron and how the investors just lost everything. Well, that's what's going to happen. It's going to be the next Enron, United Health, every insurer, every business that has to do with healthcare. If you own shares, it's gone. Because they won't tell you is they won't be able to find the money, the resources to compensate everybody for that loss. Where's it going to come from? The only place it could come from is just to compensate would be just inflating the money supply to the tune of I don't know how many trillions of dollars. Where's it going to come from? Harris has overtly supported eliminating the private health insurance currently used by 226 million people in the United States. So much for Obama's promise of if you like your health care, keep it. Where'd that go? Yeah, good luck with that.